One of the most common questions that we get during an in vitro fertilization cycle is how many embryos are we going to transfer and how do we make that decision? Well, there's a lot of data that we use and a lot of research that's been published, a lot of which came from us and from our program, but we also have guidelines that are put out by the Society for Assisted Reproductive Technology. And they've really thought this problem through very clearly and very thoroughly. And they put out a table and they put out articles that talk about how many embryos we should put in based on each individual person's specific situation. So let's break it down first and let's talk about if we do PGT or if we don't do PGT. The guidelines are very clear that if we have a PGT normal, a euploid embryo, chromosomally normal embryo, we are only to put in one embryo regardless of a patient age, unless that patient has failed 2 previous transfers. When it comes to non-PGT tested embryos, we have a little bit more leeway. And there we really rely on the patient's age as the primary criteria. So if we have blastocysts or day 5 embryos to transfer, based on the patient's age, as the patient gets older, we know that those blastocysts, even though they may look beautiful under a microscope, are unfortunately more likely to be chromosomally abnormal. And when that happens, we then are allowed to compensate for that by transferring an extra embryo. And so this is why for patients under 35, we only transfer one embryo, unless there's a special circumstance that patient has failed 2 previous transfers at least. Patients 35 to 37, typically if they're PGT tested, we'll transfer one embryo. If not, we'll transfer one, occasionally 2. 38 to 40, a little bit more leeway there. And once patients are over 40, we have even more leeway there. But why do we do this and why do we make these decisions? The primary reasons are, number 1, to keep the cost down, and number 2, to prevent multiple pregnancies. Every time a patient walks into our office, they'll typically, if they're new patients, say, I'm fine with twins. But unfortunately, they really don't know what that really means, because twins are beautiful when they're dressed alike, they look great on Christmas cards, but the problem is when they're born at 26 weeks and when they're brain damaged or when they have problems with their lung development, and now you have 2 of those babies and you have twice the expense, you think about it differently. So we are so grateful that our patients understand this issue is very important, and that they understand that we treat this issue as something that's very important, and that we work together as a team to get the greatest possibility for pregnancy with the lowest likelihood of a multiple pregnancy.